Here, the governor has asked people to voluntarily limit their activities. However, she has not ordered any new restrictions. Meantime, the CDC's director says the vaccines are not enough.
The answer to that is to really close things down, to go back to our basics, to go back to where we were last spring, last summer, and to shut things down, to flatten the curve.
CDC Director Dr. Rochelle Walensky says that's the solution to reverse the surge in COVID-19 cases because she believes Michigan cannot vaccinate quickly enough.
If we tried to vaccinate our way out of what is happening in Michigan, we would be disappointed that it took so long for the vaccine to work. We know that if vaccines go in arms today, we will not see an effect of those vaccines, depending on the vaccine, for somewhere between 2 to 6 weeks.
That coincides with the Biden administration's denial of Governor Whitmer's request for more vaccines.
Taking vaccines and shifting it to playing whack-a-mole isn't the strategy that public health leaders and scientists have laid out.
The CDC does have teams on the ground here in Michigan, keeping an eye on trends. On Friday, instead of issuing new restrictions, Governor Whitmer asked for a 2-week pause on in-person learning, youth sports, and indoor dining. A request, not an order.
Dropping our guard, moving around, that's what's going to contribute to putting ourselves in jeopardy, so don't do it.
Every time we've had surges, when we stop these things, the surge comes under control.
Dr. Matthew Sims of Beaumont Health sides with the CDC, saying another shutdown should be in order. He acknowledges COVID fatigue, but says it's to the point where his patients who want to get back to normal know exactly where they're catching the virus.
I have people who caught COVID at a poker game or at a house party or at a barbecue, or they think they got it at a restaurant. They're like, we just went to this one restaurant, and other than that, we didn't do anything. It's a lot of different events, but they've got to stop. I mean, this is where COVID is spreading.
And so Dr. Sims says since those who are over the age of 65 were a part of that first group to get the vaccine, they are once again seeing those who are younger, between the ages of 30 and 50 years old, in the hospital as well as the ICU. And so he says even younger people, kids that is, under the age of 18, they may not get as sick. However, he says they do have 2 people under the age of 18 in the ICU. Reporting live from downtown Detroit this morning, Darren Cunningham, 7 Action News.